anesthetic, you may experience the following side effects: blurred vision, dry mouth, chills, nausea, sore throat, and pain. Medications are available to help relieve some of these symptoms. The nurse will frequently check your blood pressure, heart rate, and temperature. It's normal to hear monitors that are checking and recording your vital signs. When you're awake and stable, you may be transported to the Joint Replacement Center, located on the 5th floor where your family can join you. Your room is equipped with many features to help you feel comfortable during your stay with us. Your bed is equipped with an overhead trapeze bar to help you get in and out of bed. Your bed and room temperature are adjustable to your comfort level. A call light system will allow you to let the staff know when you need anything. All rooms at the Joint Replacement Center are equipped with flat-screen cable TVs and accommodations for one family member to stay with you during your time with us. Beginning the day of surgery, you will be receiving a variety of treatments and medications to help you on your road to recovery. These might include blood tests, EKG, and/or X-rays. A Foley catheter may have been placed in your bladder during surgery. You will have an IV in place for fluids and medications, and oxygen running through a clear plastic tube in your nose. You may be connected to a heart monitor. You may also have a drain from your surgical site that helps drain fluid from your incision. All of these devices are usually removed within 1 to 2 days. You will have a surgical dressing that may need to be removed, changed, or reinforced as needed. Medications include antibiotics to help prevent infection and pain medications to help you be as pain-free as possible. During and immediately following your surgery, you will receive pain medications through your IV. When you can tolerate solid foods, you will be switched to oral pain medication. The nurse will ask you to rate your pain level during your recovery period. We use a pain scale that goes from 0 to 10. 0 means no pain at all, and 10 means the worst pain imaginable. Please don't wait until pain is severe to ask for help. The more severe the pain is, the harder it is to control. Some degree of pain is unavoidable. Our goal is to see that your recovery is as painless as possible. Therefore, take your pain medication regularly. Besides pain medication, there are other alternatives for pain relief, including watching TV, reading a good book, massage, and listening to music. You may have some side effects from anesthesia or pain medications you've received. The most common side effect is grogginess. Your thought process and memory may be impaired for the first day or so. You may experience some nausea, which can be treated with anti-nausea medications. If a breathing tube was inserted in surgery, you may experience some hoarseness or sore throat. These symptoms usually resolve on their own within 24 to 48 hours. Please let your nurse know if you have any questions related to anesthesia or your pain medicine. When people are in pain and/or have had surgery, they tend to take small breaths. These small breaths can make you prone to pneumonia. Therefore, it is important that you keep your lungs clear by coughing and deep breathing after surgery, or your doctor may order you an incentive spirometer to help with this. These breathing exercises are to be repeated 10 to 15 times every hour while awake. After you have surgery, it is important to prevent blood clots from forming. Even with the best care, it's still possible to form blood clots due to activity level decrease after surgery. This can cause blood flow to slow down and blood clots to form in the veins of your legs. To prevent this from happening, you will be encouraged to wear compression stockings, foot pumps, or compression sleeves on your legs and feet. Getting in and out of bed several times a day and doing ankle pumps while lying in bed will also help increase blood flow. Your doctor may order a special medication to make your blood thin. This may be continued when you go home. Signs of blood clots in the leg veins include increased pain in the calf and back of the knee, increased swelling in the lower leg, and redness or tenderness along the inside of the calf or thigh. If blood clots form, they can travel to your lungs. Signs and symptoms of this include sudden shortness of breath, sudden chest pain, or blood in your phlegm. Therefore, it's important if you have any of these symptoms to let the medical staff know immediately. On the day of your surgery, you'll be given ice chips and clear liquids such as soup and Jell-O. You will be given IV fluids until you're eating and drinking well. It is normal for your bowels to slow down after surgery. Drinking fluids and a high-fiber diet will help you return to normal bowel function. In addition, stool softeners and/or laxatives may be used after surgery to help regain and maintain normal bowel activity. The nurses may inquire about your normal bowel habits while you're in the hospital to help you with this. The day after your surgery, your physician will check on you and talk with you about your progress. If you have progressed to solid food, you may order from our At Your Request menu at your convenience. The menu will be placed in your room along with the number to call for your meals. Expect to work with physical therapy twice a day while you're in the hospital to teach you how to exercise, get in and out of the bed and chair safely, and to walk. They will direct you in various exercises and movements that will help you learn to strengthen and use your joint. By the second day, you should be able to ambulate to the bathroom, go up and down a few stairs, and get in and out of bed on your own. You should try to walk further each day. The staff will assist you to a chair to sit in for short periods of time. By the second day, you will be able to sit in a chair for all meals. When you are discharged depends on your progress. Patients are usually discharged post-operative day number 2. A case manager will visit with you and review your plans for care after you leave the hospital. A nurse will review your discharge instructions and provide you with information regarding your medications and follow-up appointments. You will be advised what time your family may pick you up. The staff will transport you and your belongings to the discharge area located in front of the hospital by the gift shop. Have someone stay at home with you for the first week, especially at night if possible. Allow others to assist you with necessary tasks such as driving, cooking, cleaning, and shopping. Once you go home, you should call your doctor if you notice any of the following: nausea or vomiting, signs of infection, signs of a blood clot in your legs, burning when you urinate or increased frequency, nerve problems such as inability to walk on your toes or heels, numbness, loss of bowel or bladder control, or any other things that concern you.
As we all know, infection can happen with any operation. The skin is the barrier, the body's barrier to the outside world, and when we make an incision to get into the knee joint or the hip joint, obviously there's a potential that that wound could get contaminated. Fortunately, we have modern operating rooms that risk is very, very small. And we put patients on antibiotics at the time of surgery through their IV and then after surgery for about a day to ensure that we've got patients covered against infection.
Surgical infections can occur after surgery. It is an uncommon risk, but can be a potentially serious complication. Your doctor will order antibiotics before and after surgery to prevent infections. It is normal to have a small amount of heat, redness, and swelling for several weeks after surgery.
Before the patients leave, they're instructed a couple different things. They want to be mindful, number one, if they're just not feeling well. What does that mean? Well, obviously if they're nauseous, if they're not able to keep any fluids or not able to keep food down. The other thing that'll show itself, at least in the first couple days and weeks after surgery, is the wound.
You should notify your surgeon if the following occur: temperature above 101.5, foul odor, change in color or amount of drainage from your incision, increased redness, bleeding, pain, or swelling around your incision, separation along the edge of your incision, shortness of breath or chest pain. There are many ways you can help yourself recover safely and more rapidly. First, you must participate in your recovery. No one can do this for you. You must follow your doctor's orders so that risks and complications will be minimal. You must clearly communicate concerns about any aspect of your care and recovery so that problems can be addressed as quickly as possible. Remember, you're not sick. You have had surgery to help you walk and be more active again. We will give you the education, tools, and support you and your family will need to succeed and have a rapid and safe recovery.